Right. Okay. Aloha, everyone. Thank you for joining us this afternoon, or whenever you choose to watch this. This is our first concussion conference. Hoʻoikaika Kino Foundation is putting this on in collaboration with Kino Physical Therapy. And we will be having wonderful guest speakers. Dr. Brenda Camacho is a pediatrician in our community, and she has recorded some stuff that we're going to include today. We have Mr. Jose Salcido, a wonderful ATC here on the Big Island, along with Miss Amy Malinowski. And our main presenter is going to be my student intern, Miss Kylie Corpus.
So like Malia mentioned, my name is Kylie Corpus, and I am a student intern here at Kino Physical Therapy. I am currently an undergraduate senior at Pacific University in Oregon, and I'm interested in pursuing physical therapy as a career. And so this is why I was interested in working with Malia and researching this topic of concussions.
Good job. I am Malia Talit, Doctor of Physical Therapist here at Kino Physical Therapy. And I'm very excited to put this together to help people understand a little bit more about concussions, what a concussion is, as well as aftercare. And then Jose, would you like to introduce yourself?
Aloha, my name is Jose Salcedo. I'm a certified athletic trainer with the National Athletic Trainers Association here on the Big Island.
Okay, and Miss Amy?
Hi, my name is Amy Malinowski. Sorry, my picture is frozen. I am a certified athletic trainer. I work for the DOE and Keawa High School.
Well, I'm very grateful to have all of these wonderful speakers here today. So, what is Hoʻoikaika Kino Foundation? We are working collaboratively, obviously, with Kino Physical Therapy to help provide access to rehab services for our Hawaii community. Hoʻoikaika Kino is a new foundation, and we have a bunch of different goals. But our main goals right now is that we would like our student interns to get experience through treating patients who are unable to access rehab services. So we will be hosting applications when we do have student interns coming through the office for patients who can prove that they were denied services. And then our board of directors will pick the number of patients we feel the student can manage. And then those students will be working on that patient load under my direction as the clinical instructor. We hope that all proceeds that come from these conferences, these virtual conferences, as well as other things that we will be doing, our ultimate goal is to open up a community-centered athletic training room here in Hilo. And that means we want to be able to service all athletes. That includes hunting and hula and fishing and any other recreational sport that you can think of. But we all know how we get hurt, and sometimes urgent care in the ER is not the right place for us. So we want to be able to change how we access healthcare through this. And so we hope to provide these athletic training services to all athletes, not just high school or college students, athletes, to have access to these opportunities. And there's nothing like this anywhere else in the world. So we're going to give this a try, and hopefully it does wonderful things for our community.
So through this conference, we are going to look at statistics in various areas of athletes, as well as concussion basics. And then Dr. Camacho will have her video that presents a few different cases. And then we'll look at what sideline testing and recovery can look like in an athlete. And then lastly, what you can do as a parent, a teammate, or even a coach to support athletes who have had a concussion. So first, statistics we'll be looking at is in professional sports. So on average, the NFL experiences 228 concussions per season. And then in the MMA, over the past 5 years, for every 100 athletes, 15 of them have had a concussion. And then in the MLB, 142 athletes have reported a concussion. It is important to note when looking at these numbers and even listening to the statistics coming that These are only for sports and numbers that were easily accessible, but every sport does have concussions pretty much. Volleyball, water polo, soccer, softball, you name it, there has most likely been an athlete that has had a concussion. So now we'll look at the statistics within our own state, Hawaii. So 2 in 10 athletes sustain a concussion during the school year. Of the 4 in 10 have already had a concussion and they get another one. And then for every 3 females that get a concussion, there are 2 males.
Well, that's super interesting. You would have thought it would have been the reverse, where males have more concussions than females.
Yeah. And then next, general statistics of concussions in youth sports. So 7 in 10 athletes continue to play with concussion symptoms. 4 in 10 athletes said that their coaches didn't even know that they had a possible concussion. And 70% of these concussions are a result of player-to-player contact. So now we'll go into some concussion basics, like what is a concussion? A concussion is a traumatic brain injury. It's often due to a bump, a blow, or even a jolt to the head. And this trauma leads to an alteration in brain function. And it can affect the brain in 2 ways, either in the excitatory phase, which is where we see our typical concussion symptoms like fatigue, headaches, loss of consciousness, or it can be in a spreading depression phase, which is due to the decrease in brain chemical production. And this can cause a change in mood, behavior, or even personality. And then concussions also come in 3 different grades. It can be a mild concussion that with symptoms that last less than 15 minutes and there's no loss of consciousness, or a grade 2, which is moderate. Symptoms last a little longer than 15 minutes. Again, there's no loss of consciousness, or a grade 3, where it's severe and consciousness is lost. And then now we'll just look a little bit over a few symptoms to look out for. And it is important to remember that concussion symptoms may not show up immediately, or it may even be subtle. So things to look out for is headache, loss of memory, confusion, nausea, vomiting, or even being unable to recall the incident, being confused, slow to answer, and then again, that change in mood, behavior, or personality. So concussions come in 6 different pathways. The first pathway is vision. So eye movement is greatly effective. So this can be moving the eyes side to side, which will cause trouble with reading. So this affects academically in school, or even looking at devices where young children, even teenagers, are always looking at phones or TVs, everything like that. The second pathway is the vestibular system, which allows our body to detect where we are in space. So this can affect hand-eye coordination, and then also trouble with balance and vision, which is huge for athletes, especially athletes that play sports with a ball, which is majority of them. Next, we have our cognitive processing, which is the way we process information. And this is where school can be greatly affected because concentration can be difficult. Students can be easily distracted, and it can also be hard to do long tasks or multitask. Next, we have everything dealing with the spine. So this impact causes a lot of stress on the neck, spine, and spinal cord, and this can lead to headaches. And then carrying around a heavy backpack or even slouching can make these headaches worse. Our fifth pathway is anxiety and mood, and this can cause a greater increase in worry and concern, and that can make it really hard to engage in activities and be social. And lastly, we have our post-traumatic migraine pathway, and this is where we have headaches, nausea, light sensitivity, and this causes trouble with sleeping, which will disrupt daily life. And then all six pathways come together and overlap, giving us what we see a lot of times as the main concussion symptoms, with the nausea and dizziness, balance issues, and then those mood changes and everything like that.
So Jose or Amy, would Kylie, can we go back to that please? Yeah. Is there anything, you guys being ATCs and working with our high school athletes here, did you guys want to mention anything about some of these things?
Sure. A lot of the times they'll have maybe one or two symptoms to start with, and they can progressively get worse, or sometimes they may go away. It just depends on the type of hit they sustained, where they sustained it. And it's really individual to each kid. So every kid will be different. Every concussion will be different.
Yes, I agree with that assessment. Each individual severity doesn't mean how hard they got hit, it's just how their brain reacts to the impact. And the length of time can vary from student to student. It's totally individual, and it's helpful that families know their child. They're the ones that can help report if their child is back to normal, you might say, or are they acting a little differently?
Right.
So that information also is very helpful.
Absolutely. Yeah, we know that, you're not like Amy, you mentioned, we're not, they may not have these symptoms right away. So being mindful, right after 24 to 72 hours after a potential injury may have occurred, sometimes is not enough. Sometimes I see patients where they're not even noticing that they had any problems until a little bit down the line. So maybe 2 weeks later, they're in a game situation, and now, eye-hand coordination or fatigue sets in, or, how come you played so horribly today? What's going on with you? And the kid can't explain it. There are some subtle symptoms that happen that just kind of seem out of the blue. And sometimes we think it's just because they're a teenager, they're having that attitude right now, but in actuality, we have to ask our athletes, if they're having any other symptoms, and if other things are difficult. And sometimes one of the biggest things that the kids will notice first is that they're having a hard time staying awake in class. And they're not going to think that that's drowsiness. Some of these kids don't even know what the word drowsy means, and that's okay. But what's important is that, if we see any type of change, any subtle change in children or adults for that matter, any athlete for that matter, we do need to be mindful that maybe it wasn't a blow to the head. It can be a jolt. You could, maybe have been swung around, or you moved too quickly in one direction, and it's how the brain is affected inside the skull that is causing that concussion, right?
Yes. Yes.
So now we'll look
one
at,
example.
Go ahead.
No, you said I had one example of a young student who came to me finally. He says, yeah, I've been having a headache for over a week, and trying to trace back to when it happened, and asked, why didn't you report it earlier? You just can't be taking headache medicines just to, just because.
Yeah, those things are really important. A lot of the kids are afraid to report any symptoms because they think that we're going to keep them out from playing, but not realizing that there are long-term effects if it's left unaddressed. Yeah. Okay, anything else you want to add, Amy?
No, I'm good.
All right, we'll move on, Kylie.
Okay, so now some post-concussion expectations is recovery can be as short as 2 to 3 weeks, but there is post-concussion syndrome, which is a condition that is associated with head injuries. But again, with not reporting a concussion as soon as you can, second impact syndrome can be a result, which is basically when an individual gets another head injury before the first one has time to heal. And this can have very negative side effects, and preventing it at all costs would just be really good. And also, we want a gradual return to activity, and this isn't done until symptoms start to lessen, and then return to play is not a possibility until all concussion symptoms are gone and there is a clearance by an individual registered to clear concussions. So some post-concussion symptoms are very similar to those concussion symptoms, like headache, sleep issues, being dizzy, and then the effect with mood, having trouble with remembering and concentrating and thinking. So now we'll hear from Dr. Camacho, and she'll introduce some cases as well as her ideas and thoughts on concussions.
Aloha, everybody. My name is Brenda Camacho. I'm a pediatrician in Hilo, and I'd like to thank you for inviting me to talk about this very important subject of head injury in young athletes. I wanted to start off by discussing two case scenarios. And the first case scenario is a 14-year-old female soccer player who, during practice session, had collided with another player. And this was an unrecognized head injury, and she continued to play throughout the rest of the afternoon during this practice session. Later on in the evening, she did complain of a lot of headache, nausea, vomiting, as well as some amnesia because she did not remember that there was a head injury that had occurred earlier in the afternoon. This head injury, because it was unrecognized, we feel that this probably led to her lingering symptoms for up to about 60 days following the event. And that included fatigue, confusion, ongoing dizziness, and poor focusing ability in school. Second case scenario involves a 16-year-old basketball player who was playing in a game situation and was aggressively approaching the basketball net, and he collided with the backstop in the gym headfirst, and he lost consciousness and did recover fairly quickly after that. But when and he also went on to have a lot of recurring symptoms and persistent symptoms beyond the usual 4-week period, and his symptoms lasted longer, and he needed a lot more help throughout his recovery. The acute management as well as the subsequent management are very important, and I think that helps determine the outcome for each of these players. So acute management of the players is, number one, recognizing that there is a head injury or possibly a suspected head injury, and removing that player from the game or practice for the entire day, not just for a quarter or a halftime or one game, and then continuing on later on in, several hours later, but for the entire day, this player should be removed from play. And one thing that in the data shows that the players who are not removed from play early on have a 9 times higher risk of having subsequent prolonged recovery greater than 21 days. Another very important situation you want to avoid is called the second impact syndrome. And this is where a second head injury occurs after the first without having a full recovery of from the first head injury, because this can lead to brain swelling, coma, and even death. So again, acute management is just removing the player and having them rest. So subsequent management of these players is also very important because this is the next step. So because players are usually at this time very tired, headachy, achy, dizzy, full cognitive as well as physical rest is necessary. So physical rest meaning no sports participation, and for some not even walking around. They should be resting at home. And because cognitive rest is also very necessary for an injured brain, there may be need for academic accommodations. So parents should approach the school staff and see if there can be accommodations for the child to have a reduced workload and even increasing time needed for examinations as well as assignment completions and for a brief period of time. Driving can also be a very important task for a lot of teenagers, but it is also a point where there could be a lot of disastrous things happening. So because there may be reduced reaction time by the player and even inability to recognize hazardous road situations, all driving should be reduced or actually avoided. There should also be a decreased use of electronics during this time because this helps to rest the brain and decrease stimulation to the eyes as well as the ears. And this helps promote a lot more rest for the brain. Medications should only be taken for a brief period of time and only temporarily. And medications that are recommended for comfort would be Tylenol or non-steroidal anti-inflammatories such as ibuprofen, Advil or Motrin, and just as needed on an as needed basis. Because some of these head injuries are significant enough that cause a lot of symptoms, there also may be other injuries of the body such as neck or shoulder pain. So these student athletes may also need some sort of physical therapy for those muscle strains. And some students who also experience a lot of ongoing dizziness and balance problems may need ocular vestibular physical therapy. The head injury can also cause some emotional instability because the injury can cause some chemical imbalances of the brain. There can be irritability as well as fatigue. So these players not only have the head injury, but also because their whole schedules are disrupted in terms of their academics and sports participation, they may be even more irritable and they may even go through a period of depression. So for these students, sometimes counseling is necessary on a short-term or even a longer-term basis. Return to sports for these student athletes should occur only after all symptoms have resolved and under the guidance of an athletic trainer or coaching staff. And also what's important to remember is full sports participation only should occur after successful return to full academics. Thank you for your time and attention, and let's all work together to keep our student athletes healthy.
Okay, there you go. So now we'll look at what steps are taken immediately following an athlete who gets a concussion, whether it is in practice or a game. So that immediate removal, the sideline testing, and impact testing. So Amy and Jose can talk about that.
Sure. So one of the big things that we look for is even before the seasons have started, we look at our physical forms and we look at our students' histories, especially those that have had concussions before. So it's really important if you know your child has had a concussion to put it on there so that we can know. It helps us better manage later down the line. They also, for all of our contact sports, will do baseline impact testing, which is a computer-based test and it just tests their memory, long-term, both short and long-term, their reaction times, stuff like that. It's not a test they need to study for at all. It's just purely getting a baseline of what the student is at when they're in a normal state, not a concussed state.
And then Jose, do you have anything to add on to that?
No, I agree totally with what Amy says. The baseline is so important that we know where the student athlete is before things happen. So when we test, when they get the clearance to return, to start their return to play protocol, we can test them again and see if they match their baseline. In a few instances where in this situation where it doesn't match, then we know that the student's not ready to begin the process. They need a little more rest, or they need a little more care so they can get that point where it is safe for them to start their return to play.
So this is, I know for the DOE, I think Jose guys probably have a very similar one, but their forms may be different than ours. So if a student does sustain a concussion, the first thing we're gonna do is a symptom checklist. There's about 20 symptoms on there that we go through to see how bad they are, you know, rated on a scale of 0 to 6. Then we will also do our SAC, and sometimes depending on the severity, we may do VOMs as well. And then not that day, but one of the following days, the next time we see them, we'll impact them on the computer. We will also make sure that if they are not feeling well, that they are getting the rest that they need. So they're going to be excused from school. We will let their teachers and their counselors know that there may be possible accommodations based on the symptoms that they're having. And we'll let them know, you know, and we'll have their teachers watching out for them as well to see if they're having any symptoms in class or if they're having any issues in class, but sometimes they don't tell us that. So we ask that, you know, we talk to the teachers and make sure the teachers are paying attention and letting us know about that stuff too.
And then Jose, do you have anything else?
Basically, we do pretty much the same thing. We have our steps. We go through all this assessments to see where they're at, and they have to be symptom-free before we let them take the impact test so we can compare that to their baseline. And as we start each one, we do send out information or notices to the teachers, the grade level counselors, and some of our administration staff that want to know about these things. And of course, our health room also is aware that the student has possibly sustained a concussion. So everybody's in the loop and knowing that this student needs some accommodations to help them be successful.
And we do check their symptoms every day that we see them at least. And if we're not seeing them, we have them do it at home, just so we can keep a record, so we can see how their symptoms are progressing, as well as when they do go to the doctor, that their doctor can see how their symptoms have been progressing. And then after we do the impact test, we send those scores off and they're evaluated by a neuropsychologist on Oahu who evaluates all of the tests for the state. So it's not us making the call, it is somebody who's very specialized in this making the call, saying they are good enough, their baseline, they're close enough to their baseline that they should be okay to start return to play.
Okay.
So when we start our return to play protocol, the things that are going to need to happen are they're going to have to get that clearance and pass their impact test. They're going to have to go to their physician, so their pediatrician more than likely. And this is the form that the DOE gives at least. And as you can see on it, there are different steps. So there are steps 1 through 7 on there. And 1, I don't know if you can read it, 1 is a complete and cognitive rest. Step 2 is the return to school full time. Step 3 is supervised by the athletic trainers. So most doctors will, when they're ready to start their return to play, there's a section that they can fill out that says we'll start at step 3. So step 3 is light exercise. So usually we have them walk. Step 4 is running. Step 5 is non-contact drills in full equipment. So that is specific for their sport. 6 is full contact practice. And then step 7 is a game. There is a minimum of 24 hours symptom-free in between each step. Should they start symptoms within those 24 hours, we remain on that same step when we test them again.
So this is a great place to kind of bring this up a little bit. So if a player or an athlete is getting stuck on a step, okay,
yeah.
So you know, you were going through a gradual return to activity tolerance, and increasing that intensity. And if they get stuck at a step, you know, that's where if they're getting stuck and they're not seeing improvement, you know, that's where we see parents and patients and athletes just getting very frustrated, right? I don't know how to help my kid. I don't know like what to do, you know, and it's very difficult when we have only so many athletic trainers and we have a ton of kids and different sports going on. And so if you're reaching out and looking, well, what do I do? What do I do? And, you know, this is where PT and OT can help out drastically to help these kids return to play safely. And so a lot of times when these kids are coming into our office, they don't realize how many different aspects we have to address. You know, we talked about it in that concussion phases, right? In that beautiful colored pie chart that Kylie put together. You know, and that's where our vestibular ocular, and that's our eyes and our vision. What does my vision have anything to do with this? Well, our, you know, it has a lot to do with this and in your coordination and your brain and processing all this. So if at any time an athlete gets stuck in a phase, you know, it's a great opportunity to reach out and, you know, call a physical therapist. It does not have to be Kino. It can be any physical therapist that you trust. But, you know, it's a great way. The longer you take to create an intervention for a concussion, the longer the symptoms drag out.
Agree on that. So sometimes when we have an athlete that is not seem to be progressing and it's taking longer, we will refer them back to their primary care physician. Sometimes actually send them to a neuro specialist on Oahu to get a more complete or a second opinion on how they're doing, to give us an idea of which direction we need to go for that student.
So when I was doing some research, I was able to find that Hawaii actually is one of the only states, or one of a few states, that has a concussion law. So in this, it strives to educate parents, athletes, school staff, administrators, and sport officials about concussions, and this even includes youth sports. And it also annually provides training for coaches and athletic trainers, and then provides the funding for high schools to do the neurocognitive testing. So this is when there's that immediate removal from play, from whether it is practice or a game, when a concussion is suspected, requires that clearance from a licensed healthcare provider that's trained in concussion management in order to return, and then to gradually learn and return to play protocols. Jose, do you have anything else to add on that, or?
That is very good. This, one of the few, I've worked in different states before, and having this is a huge step forward in helping our student athletes. This return to play, to make sure that they're safe, make sure that they don't have long-term effects of these multiple or many concussions, just to help educate the parents and the student athlete to not be nervous or afraid to come forward and say, "Hey, I took a hard hit. I don't quite know what's going on," and to let us be informative, share. So our return to play protocols are there for their benefit, and if someone is not progressing, we don't force them through. We have to slow down because each one has to be treated individually. Thank you.
So now we'll look at recovery. So recovery is going to look different for every individual, but generally, immediately after a concussion, there is to be rest for at least 2 days with calm activities, little to no screen time, no sports or activities, consistent wake up and bedtime, and then napping during the day to get that rest. And then about a week later, or when symptoms start to get a little better, there can be that return to light and moderate activity, like going for a walk, watching TV, returning to school with a light workload, but still sports should be avoided. And about a month later, when those symptoms are completely gone and all of the testing is passed and cleared, then return to activity is a possibility.
So one of the big points that Kylie brings up is rest by little to no screen time. So what does that mean? Little to no screen time. That means TV, computer, iPad, smartphones, video gaming, like today's, a lot of people think, oh, I'm just relaxing in front of the TV and I'm watching a movie. That's screen time. Okay. So that's a no-no. Okay. And they're like, oh, well, why can't I watch a movie? And I'm like, well, because that is stimulation for your brain. Okay. A concussion is an injury to the brain. That is what that is. And if our brain needs time to recover from it, we cannot be watching TV, especially hours on end. If you start to feel things like, my eyes are sore, or I have a slight headache, and maybe the headache, it could be like a compression feeling. It can be like a piercing feeling. You can all of a sudden have light sensitivity from it. There are many different things. Scrolling on your phone through social media is overstimulation for your brain. That is way too much visual stimulation in a screen setting for your brain in this situation. That is all screen time. Text messaging, texting back and forth, that is a very stimulating activity for your brain. So we talk about lots of sleep. Okay. The very first thing we need to be mindful of is during the first 24 to 72 hours, we really need to find out if there's any injuries that have occurred to the brain, whether it's a brain bleed, whether, there's other issues going on. And so, people have to come in and wake you up every hour just to make sure you're okay, that you're coherent, that you didn't lose consciousness, that you didn't pass out, that you're not, in a different state of mind that is of an emergency situation. So, that's, and a lot of times, anybody would get mad when you wake them up every hour, but there's a difference between I got mad because you're bothering me and my mood has all of a sudden changed. And these are how we start to see these early symptoms. And this is very important. If we don't cut the screen time, it's going to take a lot longer, and it increases your rate of recurring symptoms post-concussion that can last later on in life with no specific timeline. Okay. Jose, Amy, anything you guys want to add to that?
No, I agree with that. The screen time is, this generation, this group, taking their smartphone away from them is drastic. Some of the issues that we've had is sometimes students feel that they're being isolated or withdrawn. And this is when we try to get them with the counselors to talk over some of their anxiety of I'm missing, I'm letting my team down, I'm letting this down, to let them know they're not. This is time to heal. This is time to recover. So I know our counselors have been trained in this, and they understand, and we work very closely with them to make sure that the students get the emotional and psychological and social social things that they have taken care of as well.
And I would just add, just getting as much rest as possible. You know, as much as they don't want to do screen time, or they want to do screen time, that could very well be exacerbating their symptoms and making it take them longer to recover.
And then just one more thing to note is reducing that caffeine intake, whether it's like energy drinks, coffee, everything like that. That caffeine is also kind of like keeping your brain awake, and it doesn't let your brain rest. Okay. So now when I was also looking into concussions and prevention, everything like that, I saw a research study that looked into preseason education. They were able to conclude that their preseason education format that involved a pre-survey, a presentation, and then a survey in the middle, another presentation, and a post-survey, it increased the likelihood of their athletes to self-report their concussions because they knew what to look out for, and then they also understood the side effects of what can happen if they don't report their concussion. And then there's that link to a YouTube video that Jose introduced me to, that he shows his athletes and families to also understand concussions. And then with preventing a concussion, it's just like knowing the rules of the game, having helmets, allowing those head injuries to heal properly, and then having that proper technique. Does anyone else have anything else to add in on that?
Sure. You know, if you as a parent or a player yourself have any questions, you know, and you're not quite sure who to ask, you know, you can always reach out to your primary care provider is one. If you want to reach out to, you know, a physical therapy office, you're more than welcome to reach out to us. And if you really don't know, the best thing you can do is reach out to somebody. Okay. You know, kind of reflecting on all of this, self-reporting concussions, you know, that's the biggest thing. And Jose brought it up. Kids don't like to report the concussion. One, in fear that they can't participate anymore. Two, they're letting their team down. Three, it's a pride thing, right? Like, I can't play my sport. And some of these kids define themselves as being an athlete for that sport, and it's a huge impact on them. The best thing we can do, family, friends, coaches, is support that kid and let them know that, you know, they are important first and foremost before the sports. And if it's you know, teams need to understand that it's a team sport. If this guy's down, he's doing us no good being down. So we have to support that player, that athlete, to do what they need to do to get back to play. Okay.
Yes, I agree with that. Players reporting themselves is one thing. We try to educate all their teams, and it was really nice that one example was after a football game, everybody was checked, everyone's saying fine. We, on the road leaving the venue, we were on an away game. I get a call from one of the coaches because one of the athletes said that one of his buddies wasn't doing really well. So we turned around, went into him, and sure enough, it was after the game, after all the excitement and everything down, that this person was showing signs and symptoms of a concussion, and we had to refer him to the ER. So the team, you need to report your buddies. Take care of each other is a big thing.
Yep. So going off that, we will just kind of look into some things of how parents, coaches, trainers, and even teammates can help athletes if they do end up getting a concussion. So first, what can you expect? Those post-traumatic headaches, the vertigo, which is when you're experiencing that dizziness, those mood changes with irritability, feeling down, those cognitive issues with memory, concentration, thinking, eye tracking, and reaction time can go down. And then there'll also be a decrease in performance and balance. So all of these things are things to look out for, but also be able to provide the support that they need. So how can you use physical and occupational therapy to help this? So physical therapy can help with balance, the neck pain, managing that dizziness or nausea, increasing coordination and control. And then occupational therapy can help with increasing the confidence that to perform the necessary skills and patterns for sports. They can also help with sleep disturbances, and this might require some assistance from parents to just make sure that students and athletes are staying consistent with their wake up and sleep times. And then occupational therapy can also create a social activity and encourage engagement. So overall, physical and occupational therapy can really help with the rehabilitation process of athletes to get them back to sports, but also educate them on managing their symptoms, as well as knowing what to do and what to look out for.
Yes. So, there's, you're looking at this and going, well, what's the difference between physical therapy and occupational therapy? Well, there's a bit of a difference. If we think about it as physical therapy is helping you retain your mobility, your flexibility, strength, coordination, we help restore those foundational movements and confidence. Occupational therapy can help by getting you back to those functional activities. Players and athletes don't realize that sometimes just coordinating getting out of bed is a struggle during the recovery process with a concussion, or just like, how come I keep walking into things? How come I don't see this? How come I'm losing my balance? And those things that we take for granted become very frustrating. So occupational therapy, physical therapy in combination gives us the best outcome for the athlete. And Hawaii, we're not really used to seeing occupational therapists in an outpatient setting, but we're very fortunate here at Kino that we do have both. We do have physical therapy and occupational therapy, and that we work collaboratively to get you to your ultimate goal. We also want people to know that there are chronic triggers. Just because you get back to full play, you're able to return, you get cleared, you're feeling great, but there are still chronic triggers that can trigger the same concussion symptoms. We call them post-concussion symptoms after, and for years on end. I am a prime example of that. And we'll get into that in a moment. But there are different things that we do here at Kino to help our students, athletes of all ages, to deal with some of these things. And we do have group exercise, group things. And we've been working on mobility this summer, which has helped dramatically with a number of student athletes to restore some things that they didn't realize they had lost or that was even a problem. And mobility is not the same as flexibility or strength. Mobility is your ability to move within a range. And that is very, very important when we talk about sports-specific training and conditioning. And patient education is key. That's why we're doing this wonderful conference today, is to help our community, our parents, our coaches, players of all ages understand that it's more than just, I got a concussion, my kid is fine, get him back to play. That push is not always in the best interest of your kid. Okay. We want kids and all athletes of any ages to return back to their sport as confident as if it never even happened. There are some times we're not going to be able to do that. And that's, human. But for the most part, if we can all work together as a community, we can make this happen for our athletes.
Yeah. And if you're interested in knowing how physical and occupational therapy can work together, I actually had an opportunity to research this and write an article, and you can access it through the Kino website, just showing how Kino Physical Therapy offers this physical and occupational therapy in that outpatient setting.
And ultimately, you don't have to come to Keola Kino Physical Therapy if you don't want to. You do have the choice to choose whichever physical therapy office that you think that you can trust in providing that service for you. But we do want our community to be educated that they have options.
So here are the references for this presentation, and we would just like to thank you for your donations to the Hoʻoikaika Kino Foundation. And you'll just be helping us to put on more conferences like this, as well as building our community-centered athletic training facility. And thank you so much for your time, and you can always reach out to us and visit the website.
So before everybody runs away, I just wanted to ask Jose and Amy if there's anything you want to share, whether it was personally to you, you experienced a concussion, or a situation that you remember that was very, significant to you that might help our families in our community understand and putting all of this information together.
The biggest thing that I remember about some concussions, I don't even remember specifics, was I have had every reaction. I've been by an athlete. I've been cried on, I've been laughed at, I've been yelled at, and it's just a reaction to what has happened. It's everyone is different. So that's why it's really important for us to know our athletes, but you as parents to really be aware of how your child is acting and what their personality is. Because I've seen it where they had a concussion and they were okay, they had some symptoms, and within 10 or 15 minutes, he was a completely different person and he was slurring his words, and we ended up having to call emergency services and take him to the ER because he just went downhill fast, and that can happen, but it's not always going to happen. So that's the thing to remember is just because you get a concussion does not mean you have to go to the ER, but it is definitely important if your child is not acting like themselves or is having severe symptoms to then go to the ER. If not, follow up with your athletic trainer if you have one, or follow up with your pediatrician as well.
No, that's very good. I agree with that. Sometimes we don't hear about it, especially if the game's over a weekend and the athlete doesn't come back to school. All of a sudden you're trying to figure out, well, where were they and all that, and we'll get a call like on Tuesday or Wednesday, oh, they had a concussion, they went out. Communication is very important for our student athletes and for the athletic trainers to really know what's to help as much as we can, because if we don't know, how can we help? So communication, parents, is very important to let us know.
So I do want to take this moment to kind of talk about post-concussion episodes. So I've had many, and when I've had my series of concussions when I was playing water polo in college and in masters, it was a big deal. It was a time where concussions were not really, like, we knew there were head injuries, but it wasn't, like we understand what concussions were or understood what concussions were. And so when I finished playing in that world, I thought it was all done. And I haven't had a single concussion since then. But I'm still playing water polo. And it may not even come from my time as an athlete. But I will tell you, I was sitting down at my computer when my family asked me to look at the television. And I looked up and it was just flashing and flickering. And it caused me to spiral into a post-concussion moment. It lasted for about 15 to 20 minutes. I felt like the world around me was spinning, and then me was spinning in the opposite direction at the same time. It was just unbelievable. I couldn't believe that was happening. I couldn't tolerate the light, and I tried to stand up and get off the chair, and I fell to the ground. And for a week, it actually took me a week and a half to get back to myself. And me being a clinician and knowing what to do, my family didn't know what to do. They thought I was having an epileptic seizure on the ground, but I wasn't even convulsing. It's like, so educating our family members to recognize what, and then know what to do, and to understand that there is hope at at the end of the tunnel. I have not stopped playing water polo. I have come back to work. That was a struggle. And even knowing that, I tried to come back early, and that was a no-no. I came back to work. I saw my first patient and had to take a 2-hour nap after that. And then I had to cancel the rest of my day. I tried to see a second patient later in the afternoon, and that was a really, really bad decision. I ended up taking the next couple of days off to try and recover over the weekend. And then even then I came back to work on Monday thinking I could, just jump right back into it. And I was slurring my words. I had patients telling me that what I was explaining to them wasn't making any sense. There are so many different reasons why we want to get back to our regular life, but it is not in our best interest. But there is hope at the end of the tunnel. You can still live your life. You can still play athletics, but knowing what the risks are, knowing what you can do, and that there are services out here that can help our athletes get back to play and have that normal lifestyle. And that's extremely important, and that's why we're doing this. We want to educate our community. And I thank every single one of our wonderful presenters today, Dr. Camacho for her contribution, Jose for being here today, all the way in Arizona on a trip with his family, as well as Miss Amy at work in Cal. So I'm very, very grateful for everybody. We wanted to make this a little bit different in the fact that it's, local people, so that it's familiar faces for our community members to see. So I really appreciate everybody being here today. And Kylie, your wonderful presentation. This was a lot of work on your part.
Thank you.
So unless anybody else has anything they want to add or contribute for discussion, I think we're good.
Okay, thank you.
All right, guys, thank you very much for attending.
Yes, thank you. And thank you, Kylie. And thank you, Malia.
All right, well, you guys have a wonderful day, and we'll see you out in the community.
Yes.
Okay.